So with that, I want to introduce our panelists today. We'll go ahead and get started with Dr. Jackie Rosenthal, our MS expert and neurologist. Welcome, Dr. Rosenthal.
Hi, thank you. So glad to be here.
Happy that you're here. We appreciate you sticking around to help answer our community's questions.
For sure.
So we'll go ahead and get started. We have a lot of wonderful questions that came through the chat box today. First question here. Very good question. So, should I be concerned about my children developing MS because I have it? And secondary to that, are there any suggestions for family members, siblings to decrease risk of them obtaining MS?
Sure. So yeah, this is a really common question that we discuss a lot in clinic. And when you do have MS, your children are. The short answer is yes, they are at a higher risk for developing MS compared to the general population. That being said, it's far more likely that your child would never develop MS, even despite that higher risk. The more complicated answer is that, even as I kind of very, very briefly talked about in the talk earlier today, is that the genetics involved with MS are just super complicated. And so the genetic variation that may be present in one person's family may carry a different amount of risk compared to the genetic variation that may be contributing to someone else's family. And even though we can't really pin it down right now because we don't have that information, it's something we see. Sometimes we see families where there's just so many people with MS in that family, and other families where there is no really significant family history. And so I think that also highlights the importance of the need for research and more research into genetic studies. There is a nice amount still lacking in looking at kind of the genetic variations in European ancestry, but we could use a lot more information to help for our people and what's associated with Black Americans and the genetic variations associated there. So give us more information. How much is that risk? For the second part of that question, what could you do? If it were me, and this is my personal opinion, I would something easy to do for your child if it's someone who is like still child, so has like well checks, that sort of thing, just get their vitamin D level checked. It's easy. We know that there is the vitamin D is related to the immune system, and it relates to there's suggestions that it relates to your MS risk. And so that's something easy to do. If your child is vitamin D deficient, supplement vitamin D. If your child is an adult, just say, hey, next time you go to the doctor, get your vitamin D level checked, kind of see where you are. If you're low, go ahead and supplement. And the other thing that I think is really important is just as someone who lives with MS, you have that education, you know what to look for. And there are a lot of people who maybe were diagnosed fairly quickly, but there are a lot of people who weren't aware of their symptoms and the significance of it. And they may have gone a long time because nobody was really able to diagnose them early on after the symptoms started. But because you have that information, educate your child. Hey, these are things that if they have, if you experience it or if it happens to you, don't just let it go. One of the things I see oftentimes in younger kids, some of the teenagers that come in, is they have a symptom and it gets better and they're like, oh, it's better. So okay, I'm not going to worry about it anymore. And that's what we don't want to do. That can sometimes result in a delayed diagnosis. So yeah, education and just get a vitamin D level checked.
That's good.
Great advice. Great advice. Thank you. Next question coming through. Why didn't they have more studies on cognitive thinking or devices that can help with it?
Yeah, so part of the problem is there's just, when studies aren't these large scale studies, we don't necessarily know about them. There are a lot of smaller studies that are being done where maybe they're only enrolling patients in maybe out of a certain clinic or a certain institution. We're certainly missing these large scale studies that are looking at cognition and to answer a lot of those questions. So there are studies out there. There are studies that are looking, at cognition, for example, that I'm aware of right now that are looking just at African Americans, just at Black people living with MS. But there are and even if a study isn't looking at just one specific ethnic or racial group, it's still important that African Americans join into that study so that we can try to get adequate representation. So they're out there, but there's not large scale studies. We're missing, large controlled studies, which is ultimately what we want. But sometimes with the smaller studies are what are needed to get the information in order to give rise to those larger studies.
Thank you. I see that our other two panelists have joined us. Welcome, Tyler Campbell and Michelle Witherspoon. Thanks for joining us and sticking around to answer some of the community's questions. And since not everybody can join both of your sessions, I was hoping just to pause a moment on some of the questions coming through and start with Tyler. Tyler, would you give us maybe just a 30-second, if you could, overview of your session?
Yeah, absolutely. For our session, I think as men, we came from a place of vulnerability, transparency, and authenticity. Just the conversation about erectile dysfunction, the conversations of being made, one of the first to be diagnosed with MS in your family, and then having to combat a man's pride simultaneously, and understanding that there has been a level of trauma that have been dealt to the African American community ever since slavery was installed. So for men to just have some grace over yourself, to know that you're already dealing with a level of trauma already, and to know that it's okay to go out and get help and speak to somebody who's a psychologist or a counselor to help with what you are going through with MS, erectile dysfunction, and a host of other things. Just breaking down walls.
Mm-hmm. So important. Thanks, Tyler, for sharing that. Michelle.
Hey,
what do you want to say about your session? Hello.
Hey, Tyler. We did our pre-session. Tyler was like, "I'm gonna keep it real." I was like, "We're gonna get along so well here." So, yes, and hey, okay, our session. Let me focus. I get so excited at these sessions. So, okay. So our session was around community and resiliency. How do we bounce back? How do we support each other from our physical, emotional, psychological, cognitive, spiritual, all of those ways in which community that we show up. We had some amazing people tell their stories around the walk, and Angela shared how her goals, her milestones were just getting from here to her door, and then she's now walking up to 20 miles. And Mark talked about riding his bike for 150 miles, and then just how we have this community discussion of supporting each other. And then I shared 4 areas of demonstrating resiliency with everyone that was on our call around, nurturing yourself and taking care of yourself and your support system. So we just had fun on the call talking about community.
That's awesome.
That's great. That's great. I love that. Well, thank you for sharing a little bit about your sessions. I think we'll dive right back into our questions. We have quite a few. Let's see. Dr. Williams, another one for you. This is about exercise. If you exercise, it helps a whole lot. But are there more exercise studies for African Americans to participate in?
Mm-hmm. So there are certainly exercise studies that are being done, similar to the cognitive studies. A lot of these studies are done at certain institutions. So for example, where I work, we focus a lot on therapy, and there are a lot of exercise studies that are being done there, which obviously our patients that are coming to clinic there are aware of. But unfortunately, you don't necessarily come to our clinic or aren't aware of what we're doing. You don't know about those studies. And that's where part of the problem is. That's where the disconnect is. And so they're being done. I am not currently aware of any exercise study that is looking only at African Americans. But when African Americans and Black people living with MS join into these studies, when we come in with, again, adequate numbers, we're able to you can go in and look and say, okay, did the exercise intervention that was being done, did it have the same outcome in Black patients with MS compared to other groups? And that's important. Otherwise, we look at these results and we're like, okay, well, this was just done in a bunch of white people with MS. And so how do we know if this is going to, give the same result in an entirely different population that's dealing with a lot of different things, as we've already learned so far. And so, we don't necessarily have to look for only the studies that are, recruiting only African Americans. We just really want adequate representation in all the studies that are being done right now in MS to give us the best information.
Hey, Janelle, didn't Dr. Williams on Monday talk about, I'm sorry, I didn't say hey to you, Dr. Rosenthal. I'm sorry. You're at the bottom of my screen. I don't want you to think I'm not sending you the love. Didn't Dr. Williams talk on Monday about a clinical trial for African Americans? I didn't capture it. Do we want to revisit that today? Dr. Rosenthal, are you familiar with that one?
Yeah, so that's the CHIMES study, and it's looking at, it's looking specifically at ocrelizumab, which is a disease-modifying therapy that's used in multiple sclerosis. It's used for relapsing, remitting, and primary progressive MS. This particular study is looking at individuals with relapsing, remitting MS. They're enrolling African Americans and Hispanic Latinos into this study, in large part because of the very low numbers. There were only 72 Black people in the original Ocrevus treatment trial. And so that was a very, low proportion. And so, this is a medication that's being used a lot, and we need to do the research to make sure that it has the same outcomes as it does in the population that's already been studied in.
I'm on that one, so I'm gonna raise my hand as soon as we hang up from this call.
Hey, Dr. Rosenthal coming with fire today.
I mean,
yes.
That's right.
Fire.
That's right.
Yes. Good.
Speaking of fire, Tyler, this question is for you, but I think, Michelle, without this, you might want to answer this question too. So Tyler, originally directed to you. As a man with MS, in hindsight, what symptoms did you ignore leading up to your diagnosis? And Michelle, as a woman, maybe you can share with us your experience as well.
For me, I know immediately. I can actually date back to high school. I was 21 when I got the official diagnosis. I can date back to times of being 17 and 18 and recognizing that when I competed in sports, I was always lethargic and tired. And as a result, because you live in this level of masculinity and competition, I thought that if I worked harder, it would help me, and that I was just always out of shape. So I always did 2-a-days and extra weights and extra running all the time. All the while, I just thinking I was just increasing myself to have a flare up sooner. But for me, it was constant fatigue and being lethargic and looking at everybody else and being like, why can't I keep up?
Wow.
Yeah. And that was, Tyler, when we talked earlier, I was like, wow, because you're so young. On the call we just came off of, Alea was on that call, and she's so young. So, I just think it's so important to have a different point of view on these calls from a millennial point of view to say, pay attention. My sister was diagnosed really young too. She was diagnosed right out of college where her feet kept getting numb. She kept going to the doctor, and no disrespect to any doctors, especially not you, Dr. Rosenthal, but they were like, buy different shoes. And they just weren't having a conversation with Black people the same way. They were resented. And so eventually she winded up looking like she had a stroke. And then all of a sudden it was like, oh, here's something really wrong. So by the time she was diagnosed, several years before me, so I was familiar with the disease. What happened for me is I started to lose my eyesight, but I was thinking that something was wrong with the computers in the office. And so I called the tech people to come up and fix the computers. But over a 24-hour period, my eyesight just totally almost diminished. And so for me, and I kind of knew that it was MS. And so my symptoms were really quickly from eyesight. And even to this day, majority of my symptoms have to do with me losing my eyesight, whereas my sister, she doesn't ever really have those challenges. And I always bring that up because we all on this platform have MS, but our symptoms might not be the same. And so that's why I think more Black people need to participate in these studies, because we don't. Okay, I won't go there, Dr. Rose. So I'm gonna let you finish that later. But that's how my symptoms presented themselves.
Yeah. No, that's really good. That's really good, Michelle. So let's talk a little bit about that. So there's a comment from the community. It says many African Americans have a distrust of medical research due to historical and systemic racism. So how can we encourage drug companies and research programs to conduct outreach to African American communities oversample? And how can we encourage African Americans and Black folks to participate?
Is this one for me?
Yes.
Okay. This right here is a perfect example of how to do outreach. I think part of the problem is knowing that there is that mistrust. Too many researchers maybe just let that lie. This person isn't interested, or they don't look like they're interested, or in that sort of thing. But really reaching out, I would never want anyone to participate in a research study that they did not fully understand and weren't comfortable moving forward with. And so I think part of it comes on, on the researchers' shoulders, on the provider's shoulders, to really communicate with patients and let all the information just be very transparent. If I can do the best myself to put myself in someone else's shoes, but if I feel like someone is being completely forthcoming with me and is truly concerned about me, I'm going to be more inclined to be more open-minded to certain things. But these types of outreach programs are definitely what's needed. Part of it is, I think, that there are a lot of people living with MS, Black people living with MS, who aren't aware necessarily of all these gaps that are, and if once they are, they're like, oh, let me do something about it. So it's just a lot of education.
Sure. Yeah. Yeah.
Can I say something real quick to Doc? Doc, this changed my life when I was young and being diagnosed. I had a neurologist that came to me, and he's still my neurologist, and he asked me, he said, Tyler, what are you looking to get out of me being your neurologist? And I felt like he allowed me to take the power of the appointment back to me. Does that make sense? And and it allowed me, being so young, to really open up to him. Do you see a lot of that from doctors? It was the first time I was ever asked that, and I had doctors, prior.
I mean, I've seen different ways of approaching this, and I feel fortunate that I can take the time to have the discussions that you need to make sure that the person I'm speaking with is given the information to make their decision. I don't want to just bark at somebody. This is what you have. This is what you should do. And I'm a doctor, so you should believe me. That does not go over well, because someone will nod in your face and then go and do what they want to do. I feel like if you as a patient can understand what's going on, why we want to do treatment, all of that, now you're making the decisions too, because I'm not running anything. We're doing this together. And once my experience is once a patient realizes that and feels like, okay, I'm in this as well, I'm doing what I think is best for me rather than what they think is best for me, it's so much more of a successful relationship.
That's good, Doc.
Yeah, we talked about that on our session a little bit when we talked about community and resiliency around how do you take responsibility and actions for yourself, right? And I think lots of times we give too much power to the doctor, and so so I think to me, I show up as this is a joint venture that we're investing in. I'm paying you to give me some advice around my body. Right. And so I take responsibility when I go into the doctor's office with my notepad. And if I don't understand something, I'll say, I don't understand that. Why are you switching me to this medication? And I'm just not a big fan of keep switching. And then in our current system, all the doctors don't talk to each other. So I may go see my neurologist here, but over here I got my regular doctor giving me something else. And so I just think we talked a lot about, taking action to solve your problems and showing up and being your advocate and using your community to reinforce and learn.
That's good.
Love that. So Dr. Rosenthal, how can people find out more information about clinical trials that are happening in their area?
I would really direct you to that clinicaltrials.gov website, because I think it has the most information. And even though it could be overwhelming, you are able to search by like geographic location as well, which can really narrow it down for you and what may be reasonable for you. I would start there. And then the other thing is just talking with your neurologist, hey, what's going on? I'm interested in this, that, or the other, and seeing what opportunities they may know of to help you get involved with. You can talk with physical therapists as well, different types of, your whole team of people, and see what opportunities there are.
Yeah, that's great. That's great. So Tyler, you mentioned how your doctor made you feel so empowered upon, how you would move along your journey and how you would manage your MS. And so I put this question out to you and also to Michelle to share with the community. What is the one thing you do every day to make sure you're turning your MS into multiple strengths?
Man, it's Michelle. Do you want me to go first?
Yes, you go. Go ahead. Such a gentleman.
Y'all don't know this. If you step on Michelle, it's like a rattlesnake. She's gonna bite you. So I think one of the gentlemen had kind of asked me this as well, and I challenge everybody. Like, I wake up to get up. You know what I'm saying? Like, I wake up to get up, and the thing is, like, we got to recognize that we are blessed to wake up, right? Somebody didn't get that opportunity, but just getting the wake up, that's not enough. You got to wake up to get up. Don't wake up to hit the snooze button. Don't wake up to hit the radio. Don't wake up to just talk. Don't wake up to turn on the TV. Wake up to get up on a mission because somebody else didn't get the opportunity to even open up their eyes. And so when I know I have my eyes open and I've got breath, I take whatever I can to combat with MS with it. Like, if I have the breath and I have the capability to see today, that means MS is about to become my prisoner today. Straight up, because I'm already winning the victory. I'm up, and so I got to get up.
Yeah, Tyler, it's so good. There's this quote that I have. Your life is happening right now in front of you. So what are you doing with it? Right. And so lots of times, I think sometimes, and we all have done this. I've done this myself. We let fear stop us. I think I said this on the last call, and I don't know where I got this quote from. So you'll have to Google it to see who it came from. But fear is just false evidence of things appearing real. And right. And the reason why I bring that up in here, because sometimes when we have MS, that becomes our go-to for not doing something. Oh, I got MS. My foot is hurting. I can't go out to dinner with you. Oh, I got MS. My thought process. And sometimes these things are real, but don't let the fear stop you of things appearing real, because your life is happening right now in front of us. And so when I was first diagnosed, I remember going to my first meeting and I walked in. First of all, I didn't see anybody that looked like myself, which is why we started the African American Conference here in North Carolina. But second of all, was most of the people were in this particular meeting were in wheelchairs or canes. And for me at the time, brand new, I was like, oh, is this where I will be? And so instead of leaning into that learning, I leaned back with fear instead of leaning in saying, what can I do differently? And so I just, I wake up every day saying, okay, I'm going to go in beast mode. That's my whole thing. Like, I stay in beast mode. What can I do to continue to keep excelling? And then here they started a working women's group with people with MS. And so I started to join that. I did the things that were good for me. Everybody's different. You got to find that community for you. Yeah. This is the community that worked for me.
Michelle, I love it. Listen, let me piggyback off it. Y'all write this down. Jim Aframo has an amazing book, and he says, fear, face everything and respond.
Good. I'm writing that one down.
Face everything and respond. So that's what fear is for us. We got to face it with MS, and we have to respond. Take it away, my dear.
That's great. I love it. Sorry. Dr. Rosenthal, someone wants to know if there's a specific vitamin D test. I think this goes back to the advice that you gave about getting your kids tested. But is there a specific vitamin D test for African Americans? Also, what other alternative options for fatigue and cognition? Are there other options for fatigue and cognition?
So for the vitamin D, it's just a blood test, same blood test that everyone gets. And for fatigue and cognition, because they're both so very complicated, you really have to talk about it with your neurologist. Just both fatigue and cognition can be, impacted by sleep, by pain, by, depression, mood symptoms. And so there are medications you can take for fatigue, for example, but I think you would be doing yourself a disservice going straight to a medication when you're not addressing any potential reversible contributor. And so it's always important to address those first. After all is said and done, from a fatigue standpoint, if you're still, having problems that are impairing you on a day-to-day basis, you can't do the things that you find enjoyable, you can't do the things that you need to do, then there are medications that you can discuss with your neurologist. For cognition, unfortunately, when we talk about like medications, like in MS, to treat the same way you would a different type of dementia, for example, there's no evidence that they work the same way. So the treatments are really more of a focus on non-pharmacologic treatments. Again, if you talk about it with your neurologist, there may be options with regard to like cognitive therapy and that sort of thing. But again, because there's so many multifactorial things going on that patients with MS deal with, it's always important to really make sure that you're not treating the symptom without maybe getting to the root of any other, contributors.
Dr. Rosenthal, it's so interesting that question was asked. I won't show the brand name on here, but this is my vitamin D that sits on my desk, and they're dissolvable easy melts. Oh, said the brand name. Sorry. And so, but I literally all throughout the day, I'll pop one or two in a day, and then I have the same thing for B12. Right. And it just really helps me with my energy. And so even though I'm not on Tysabri anymore, I'm on Orcavis. When you're on Tysabri, or my neurologist is always doing the vitamin D test, even when they don't do them now, I just request them. So that I can still see where I am against that, because it was so, and I can feel when it's low. I can feel when I've missed a lot and I don't pay attention to it. I literally can feel it. And then I'll make sure that I get back on that regimen. And so I try to keep it really natural. And I think that's helped a lot for me.
That's good.
Yeah.
So Dr. Rosenthal, there's a couple questions that are coming through, all related to disease modifying therapies. So this is like a three-parter, if you will. Is it possible to no longer need to be on a disease modifying therapy, or should be discontinued after a patient has reached age 62 plus? So I'll let you answer that first, and then I'll tag on the next question.
So maybe, with MS, I'm sure everyone knows, it's so variable, Oftentimes at the age of 62, if you have MS, you probably had it for 20, 30, or 40 years. But also sometimes I see someone at 62 that's coming in with their first symptom. And so everyone is different. If you've had MS for a very long time and things have been relatively stable, it may be worth having a conversation with your neurologist about whether or not they think that's something that can be done. When we talk about the natural history of MS, oftentimes things are a little more active early on in the disease, and years down the road, they do calm down. But I've been, surprised by disease activity all the time, so not everyone follows those rules. And so it's very much an individualized decision. It's also not without risk. And so you really have to kind of weigh, okay, I don't want to be on this medicine. Am I willing to take on the chance, even though it may be a very small chance, that if I get off of this medicine, I may have some disease activity. And, again, there's not a black and white answer here. It really is a decision that you would have to talk about with your doctor, and kind of the pros and cons, because that answer for you is going to be completely different for someone else, even if you're at the same age.
Yes, ma'am.
And then kind of secondary to that, were the post hoc racial group differences in disease modifying therapies statistically significant?
So I presented post hoc analyses on, one was on the interferons, and the majority of those were more of a statistical trend. with the exception of the MRI data. So with the MRI data, that was statistically significant. But part of that is because the numbers were just so low. There's like 36 African Americans in that study, very low. With the other ones, they weren't directly compared to the white Americans that were included in those studies. They were more looking at how does this drug work versus the comparator drug, natalizumab versus placebo, for example, alemtuzumab versus, interferon, for example. Those were statistically significant in the African American group. Those drugs did work better than the comparator.
Great, thank you. So you all, this time goes by so fast. It is never enough time. I think maybe I'll improvise with this question here. The question is really, what are the top 3 issues people should know about men diagnosed with MS? Maybe name at least one, Tyler, in the interest of time.
Man, men diagnosed with MS, like erectile dysfunction is real. And I think we all know as a man's pride. And if we're talking about Black males in terms of how we've been cultured and how we've calloused ourselves in such a way to not open up about our problems, how we live by that saying as a whole, as a community, of what goes on in this house stays in this house. So the fact that erectile dysfunction is feasible, is possible with MS, no matter your age, no matter what, just knowing that as a man, that's a heavy weight to carry. Where do I go? Who do I confront? And it's a conundrum, and it's all the reason as to why us as men, we have to speak up so we can stand out and allow your say to say, hey, this is a part of MS. Erectile dysfunction does happen, but that doesn't mean that you can't have a quality life. Doesn't mean you can't have a wife and children, as I expressed to the gentleman today. Doesn't mean you can't go out and enjoy the lifestyle that you have to live. As a gentleman, having somebody to say those things, it helps. But that is something that a man with MS can go through.
Yeah. Thanks for keeping it real, Tyler. Well, if we didn't get to your question today, I want to remind you that one of the best places to get up-to-date and reliable information about MS is the National MS Society MS Navigator team. And you can reach them by calling the toll-free number at 1-800-344-4867. You can email, you can jump online and chat with someone in the chat box. I want to thank our program host, Damian Washington, for sharing a bit about himself and making everyone feel so welcome. I want to thank you to our outstanding presenters today, Dr. Jackie Rosenthal, Tyler Campbell, Michelle Witherspoon, and all of our community members that joined. I want to thank our wonderful advisory committee and our staff behind the scenes doing so much work. A special thank you to all of our amazing sponsors, our convening contributors, Bristol Myers Squibb, Janssen Neuroscience Johnson & Johnson, our valued contributors, Biogen, Genentech, Google, Optum, Sanofi Genzyme, and our supporting contributors, Joseph and Teresa Roseborough and Mandy Johnson. I know many of you are wanting to know how to get involved, and I want to remind you about an important survey. Please don't delete it. Please fill out the survey. We need to hear you. We need to know what you want to hear about. We build our programs to support you, the MS community. So as we conclude our Black MS Experience Summit, I just want to thank you, the members of the Black MS community. You joined, you shared, you learned, you engaged. You know, it's often said that when we don't see reflections of ourselves and our voices, our experiences, and our perspectives are not heard, that we sometimes are left feeling invisible. So we know the power of seeing our own reflections. And today and yesterday and Tuesday, you really embodied a safe space where we all could feel seen, heard, and understood, and thereby supported. So you are not invisible. You are essential. You hear me? You're essential to the MS movement. And we hope that you begin to see reflections of yourself in your MS society. We hope that you feel inspired and that you have hope. You carry that with you. And on behalf of the National MS Society, I'm wishing you and your families love and light. And we'll see you soon. Thank you to
Peace
everyone.
and soul.